Strabismus, put simply, is you have an eye that crosses in, crosses out, up, or down. It can get very complex. There's a whole lot of different types of strabismus, and I'm not going to go into that detail in this video. So when you come in for your evaluation and you've been diagnosed with strabismus, we can talk a lot more specifically about the type of strabismus that you have. But to keep things simple, I just wanted to explain a few things about strabismus and things that we can do to help treat it. So essentially, you have two major types of strabismus. You have a constant strabismus, either a constant esotropia or exotropia. So your eyes are crossed out or in, and the one that is crossed in or out constantly stays that way. So that eye is always going to cross in or always going to cross out. That is the worst type of strabismus you can have, because when that happens, when your eye crosses in or crosses out, if you're using that eye, you're going to see double, and your brain does not want to see double. And so what it's going to do is going to start ignoring that eye. And so as soon as a child develops that, the brain starts to ignore that eye immediately. And if we don't catch this early enough and treat it, then it's really hard to regain full vision in that eye, because the brain has ignored it from such a young age. So it's very, very important that we catch strabismus very early and we treat it as early as we can. Alternating strabismus means that you have an eye that alternates crossing in. So the left eye crosses in, the right eye crosses in, and they go back and forth. Or you have alternating exotropia, where the right eye crosses out and then the left eye crosses out, and they alternate back and forth like that. So when you have alternating strabismus, you typically have pretty good vision in both eyes. The trouble with it is that you're never using the eyes together. So you're always just using one eye at a time, and so you never develop really good depth perception. This one can be a little bit harder to treat too, because people are not used to using their eyes together, and so we have to teach them how to use both eyes together. So when it comes to vision therapy and strabismus, I never recommend surgery as a first-line defense for strabismus unless it is a very severe case and there's nothing that we can do with vision therapy. But I always recommend trying vision therapy first, because your eye is crossed in or out as a result of some kind of programming in your brain that is telling that eye to cross in or out. And if we can interrupt that programming and reprogram it the right way to where it will learn to be straight on its own without surgery, that's the best case. So if you have a child that has it, and depending on the severity of it, I always recommend doing a few months of vision therapy on the front end and see if we can start making some progress. If we can make really good progress in vision therapy, then I never recommend having surgery. If we have tried as hard as we can and we've done vision therapy for several months and we're not making any progress, and we're concerned that that eye is going to just not wake up, it's going to always suppress itself, you're never going to regain vision in that eye unless you have surgery, that is a situation where I will recommend surgery. But just like anything else, if you go in and you have surgery on your knee, after you have knee surgery, you go to the physical therapist and you have physical therapy to help recover that knee. So if you do have strabismus surgery, I always recommend doing vision therapy afterwards, because with vision therapy, we are going to teach your brain how to use both eyes together so that you can develop good depth perception, and hopefully you'll never have to have strabismus surgery again. Because the trouble with surgery is that most of the time, kids don't have just one strabismus surgery. I believe the average surgery is you have one, you're a lot more likely to have two, and then to have three after you've had that, because it's not perfect. I've even seen kids that have had strabismus surgery for an eye that crossed in, and then the eye crosses out over time. So surgery, like I said, is not the first choice. There are certain situations where I do recommend it, but it's never the first option that I talk about with strabismus. And so strabismus is the thing that takes the longest to help in vision therapy. Usually it takes more than a year, more like 18 months to 2 years of very hard work, depending on the level of severity and the type of strabismus that you have. So it's one of those diagnoses that we never want to give a child, but it is something that we can help with. We just have to be committed to it, and we have to put in the work, and we can help your child see much better if we do vision therapy. So if you have any questions about it, feel free to reach out to me. You can send me an email at the address below, or just leave a comment on this video. Thanks for watching.